AHI is based out of the University of Michigan, but we provide training, technical assistance, consulting, and resource development to healthcare providers, health systems, and youth-serving organizations across the country. So our objectives today. Following this webinar, attendees should be able to describe the components of adolescent-centered care, identify opportunities to improve delivery of adolescent-centered care in their own practice, and obtain resources to help providers and staff enhance adolescent-centered practices. Let's get started. So why is adolescent-centered care important? Why are we here today? So AHI spoke with health professionals from across the country to identify their barriers in providing high-quality adolescent-centered care. And we heard similar responses, that there was not enough time during the visit, that it's hard to get adolescents in the door in the first place, and that it's challenging to get teens to open up to you as a provider. And so from coast to coast, there was also this one common thread that stood out. Providers were saying that they were missing opportunities for providing patient-centered care and impacting patient-centered outcomes. So take a moment to kind of let that sink in. Healthcare professionals across the country were saying they don't feel like they can provide high-quality care to adolescents and impact their outcomes because of constraints with their clinic environment, policies, professional trainings, and more. All right. So let's take a moment to hear directly from teens about their thoughts on what an adolescent-centered medical home should look like. So this 3-minute video was created by the Adolescent Health Initiative's Teen Advisory Council.
Hi, I'm Julie.
I'm Brandon.
I'm Clara.
And I'm Felipe.
We're here to talk about some ways that health centers can meet the needs of teens and young adults through things like physical space, policies, and personal interactions.
There are tons of ways to help teens feel welcome. Here are some of our ideas.
For some of us, getting to appointments can be challenging.
Having bike racks outside can make it easier for when we don't have transportation.
Posting hours outside your clinic is important, and make sure you have times after school hours so students can get there too.
It can really help some of us with unpredictable.
Hi, I'm Julie.
I'm Brandon.
I'm Clara.
And I'm Felipe.
We're here to talk about some ways that health centers can meet the needs of teens and young adults through things like physical space, policies, and personal interactions.
There are tons of ways to help teens feel welcome. Here are some of our ideas.
For some of us, getting to appointments can be challenging.
Having bike racks outside can make it easier for when we don't have transportation.
Posting hours outside your clinic is important, and make sure you have times after school hours so students can get there too.
It can really help some of us with unpredictable schedules if you accept walk-ins.
And if we happen to run late for an appointment, please try not to make us feel like we've broken the law.
The more comfortable we feel, the more we'll want to come back, which will help us get better health care.
Your waiting room matters. It's our first impression and a place where your teen patients will have to, well, wait. But hopefully not too long.
And waiting means sitting, so why not have comfortable options for all shapes, sizes, and ages?
I know doctors' offices are for little kids, but they're for teens too.
Why not show a diversity of styles and types of artwork?
And maybe even feature some pieces by local teen artists.
I'd like that.
Real plants are great too, but if they don't look taken care of, it makes me feel like I might not be either.
Magazines are standard in any waiting room, but why not have some that are geared to teens, like 17 or Electronic Gaming Monthly?
No, I want Mad Magazine or J14. Or Wi-Fi. I'd like the Wi-Fi password posted even better.
Hey, what about magazines in other languages? Y servicios de traducción en otros idiomas sería aún mejor.
Yeah, also show that the space is safe and inclusive of LGBTQ plus youth, such as a rainbow sticker on the door.
Teens can have pretty different interests, but one thing that matters to all of us is privacy.
Definitely. Having some kind of dividers at the reception counter can help keep us comfortable when we share private information.
I've even been at a place that had a white noise machine to make it hard to overhear.
As much as we love the reception area, we're really here to get into the exam room.
Of course we expect it to be clean and professional, so what matters most is our interaction with our doctor.
This means we're getting good eye contact, non-judgmental listening, and welcoming body language.
Having your confidentiality policy clearly posted in the room really helps us feel comfortable being honest.
And so is doing check-ins throughout our appointment to make sure we're on the same page.
Remember, not all situations are the same, and not all teens are the same. When in doubt, ask us.
All right. So now I want to hear from you. What do you think the consequences can be when teens don't feel comfortable with their healthcare experience? So take a minute and chat into the chat feature what you think those consequences can be. Oops, so it looks like we are launching a poll that we don't want to quite launch yet. We actually just want you to chat into the chat box what you think the consequences can be when youth don't feel comfortable with their healthcare experience. And we are going to simultaneously figure out how to toggle over and see your responses. So bear with us a second as you chat those in. So it sounds like all right, so we're seeing some of your responses now. Oh, great. All right, you're right. Exactly. They're not going to return or follow up. They're not going to want to come back, maybe at all. And yeah, I think they're not going to want to disclose very much. It sounds like some of you are saying they're not going to want to share details. Exactly. And you know, sometimes I hear people also say they're going to tell their friends what happened as well, right? They're going to kind of share their experience. Yep, they won't be compliant with care. Exactly. I see someone saying what I just said. They're going to share their experience with their peers and they will not come back. All less likely to engage. Yep. All things that could happen when a young person does not feel comfortable with their health. Great. Thank you for those responses. So we also know that there can be positive consequences when teens do feel comfortable with their healthcare experience. For example, a teen is going to be more likely to talk with their provider about their behaviors and feelings. This in turn is going to allow the provider to offer more comprehensive care, which can lead to ultimately better outcomes for their patients. So one of the main goals with becoming more youth-friendly is to look at how we interact with young people and help them feel welcome in the health center. And there are a lot of ways that health centers can be welcoming to young people. So we're going to take a moment now and review 8 youth-friendly behaviors. All right, so accurately discusses and applies confidentiality consent laws with all adolescent patients, provides and or supports fair treatment and equal opportunity for all adolescent patients, listens to and objectively considers what adolescent patients have to say, accommodates needs of individual adolescent patients, including things like tardiness, bringing a friend, or whatever other need there might be, uses positive body language and an approachable, warm tone when communicating with adolescents, patiently helps adolescents navigate referrals and any other systems that may be challenging, avoids using medical jargon when communicating with adolescents, uses sensitivity and maintains neutral language and body language with adolescents, withholding judgment related to sensitive subjects such as sexual health, substance use, interpersonal violence, sexual orientation, gender and personal expression, and mental health. Okay, so now I'm going to read some scenarios, examples of things that can happen in a health center. So again, using the chat feature, type in the corresponding youth-friendly behavior that you see on your screen. So here's the first scenario. Studies have shown that providers often don't counsel their adolescent patients with chronic illness on reproductive and sexual health. Even though adolescents with chronic illness participate in sexual activity at similar rates to their peers without chronic illness. So which youth-friendly behavior does this relate to? And keep in mind, this is obviously an example of what not to do. Ooh, can you guys hear me? It looks like I'm getting some feedback that I sound muffled. How about now? Can you hear me better now? Okay. Yep, I'm gonna reread the scenario for you. So it sounds like you can hear me a little more. So sorry about that. We've readjusted. So here's the scenario again. Studies have shown that providers often don't counsel adolescent patients with chronic illness on reproductive and sexual health, even though adolescents with chronic illness participate in sexual activity at similar rates to their peers without chronic illness. So which youth-friendly behavior that you see on the screen here does this relate to? And keep in mind, this is obviously an example of what not to do. So which one of these things does that relate to? Yep, it definitely corresponds to 8, corresponds to number 2 as well, provides and supports fair treatment and equal opportunity for all adolescent patients. Yep. Agreed. Okay, so here's another scenario. The following story is from Ray at age 23. When I explained to the staff that I didn't have insurance, she was like, oh, there's this program and there's this resource and you can get help here, or you can go this route. And I was just like, whoa, no one ever told me that before. Whenever I was given options and I didn't feel hopeless, it was a good experience. So which youth-friendly behavior does this exemplify? 6, patiently helps adolescents navigate referrals and any other systems that may be challenging. Yep, agreed. I see lots of people chiming in. 6. Oh, and also 4. Yep, 4 and 3. Definitely, you can see how these scenarios are gonna play into multiple of these. Okay, so let's do one more. My mom talks to her and she talks to my mom. I'm just there. I'm just there to get poked. This is a quote from Luis at age 16, and it is another example of a not so adolescent friendly interaction. So which one does this relate to? Yep, I'm seeing a lot of 3s, agreed, listens to and objectively considers what adolescent patients have to say. Great. All right. Okay, so we're now going to shift our focus from youth-friendly behaviors to adolescent-centered environments. So to start, let's all get on the same page about what we mean. So here's AHI's definition. Adolescent-centered environments encompass the policies, practices, services, and physical space of health centers. They are inclusive of, informed by, and responsive to the needs and values of adolescents. Adolescent-centered environments effectively provide comprehensive services for adolescents, ensuring they feel well cared for. So with this definition in mind, AHI works with health centers across the country to become certified using our Adolescent-Centered Environment Assessment Process, or the ASAP. I'm going to briefly describe the ASAP process, and then we're going to spend the rest of our time together identifying opportunities and resources to help you improve adolescent-centered care in your own practice. So as we know, adolescents experience unique healthcare needs that often go unmet. So at AHI, we know that health centers face many competing demands to provide excellent care to all of their patients. And we also know that health centers can play a key role in meeting the needs of adolescent patients and empowering them to establish lifelong healthy behaviors. So the ASAP is intended to remove barriers to change and streamline processes and implementation to improve care delivery to adolescent patients. So participating health centers identify an ASAP team, and that typically includes a provider, health center manager, and 2 or 3 other staff members who are invested in improving care for adolescents, such as a social worker, a medical assistant, or front desk staff. AHI works with this team to complete a baseline facilitated self-assessment. And as part of the assessment, the health center's ASAP team identifies priority areas but they want to work on for the coming year. So something like improving HPV immunization rates, prioritizing long-acting reversible contraception or LARC as a first-line method of birth control, or starting a youth advisory council. So AHI takes those priority areas and then creates a customized implementation plan for the site. And the implementation plan includes workflows and trainings and curated resources for the participating health center. So their kind of AHI coach works with the ASAP team over an 18-month process to help achieve self-driven health center improvements and measure success at the year-end assessment and through data collection. So currently the ASAP is being used across multiple states highlighted here in dark blue, and AHI is also scheduled to start working with health centers in more states highlighted in light blue by early 2018. So it's really exciting to see that there are so many health centers across the country who are really kind of committing to doing an intensive quality improvement process to provide adolescent-centered care. So the assessment tool used in this process is informed by best practices and standards of care from the CDC, the American Academy of Pediatrics, American Academy of Family Physicians, World Health Organization, and then other clinical and academic leaders. And additionally, it's been reviewed by our team of multidisciplinary experts and most importantly by our Teen Advisory Council. So the assessment tool is divided up into 12 key areas of adolescent-centered care. So access to care, adolescent-centered environment, confidentiality, best practices and standards of care, reproductive and sexual health, behavioral health, nutritional health, cultural responsiveness, staff attitude and respectful treatment, adolescent engagement and empowerment, parent engagement, and finally community engagement. So there are specific indicators within each section of the ASAP tool. So for example, one indicator under the first section, access to care, would be our health center offers extended hours for adolescents, including some evenings and weekends. So every ASAP question on the ASAP is scored on a 0 to 2 scale. So a 0 means that an indicator has not yet been implemented at your health center. A 1 means that the indicator has been partially implemented, and a 2 means that it has been fully implemented at your health center. And as you can see, there's also a key that highlights some special considerations. And those point out if an ASAP indicator corresponds to a HEDIS measure, aligns with patient-centered medical home designation, or is a certification requirement for becoming an adolescent-centered environment. Okay, so now let's practice. So for the rest of our time together, we're going to focus in on 3 areas of adolescent-centered care: adolescent-appropriate environment, cultural responsiveness, and adolescent empowerment and engagement. So we're going to show you some sample indicators from the ASAP and share resources and strategies you may want to consider when you're enhancing care for your patients. Okay, so now we're going to take a quick poll. So using the 0 to 2 scoring system that we just talked about, please answer the following question. Our health center has visual cues throughout the waiting area and exam rooms indicating that adolescents are a welcomed and valued population. All right. All right, great. It looks like there's a pretty even mix here. Looks like a good majority of people are kind of the partially implemented phase. They've maybe done some things to make their environment feel this way and are kind of working on it. Some people are just at the beginning, and some folks feel like they've already done this, which is great. So we've got kind of a nice mix of people in the room. All right. So health center decor is often geared towards adults and or young children. And a waiting room that's full of cartoons or kid books isn't gonna necessarily make a 15-year-old waiting for their appointment think to themselves, this place is for me and the people here are gonna understand what my needs are. So you want to be able to make sure that you've got visual cues that resonate with adolescents and young adults. And this can look like posters geared towards young people or art that is age appropriate or created by the young people themselves. AHI's Teen Advisory Council has created the posters that you see here that display a simple message that adolescents are a welcomed and valued population. These posters we have available in English and Spanish, and they're available for free download on our website, as well as some other materials that can serve as visual cues, and again, that you can just get at our website. Appropriate reading materials displayed throughout the waiting room and exam rooms are also another way to make adolescents feel welcomed. Educational posters can clear up misconceptions and also prompt young people to think about some questions that they may want to ask their provider. So this example here, the CDC has some free HPV posters and handouts geared towards younger adolescents that are available from their website for printing. And many of us, not just teens, use smartphones while we're waiting for an appointment. So consider some smartphone modules that adolescents can download and review while they are waiting to be seen. So here are some examples. Smoke-Free Teens, Iron Kids, Teen Hotlines, Teen Depression Connect, Fujicate, and My Birth Control. We also know that adolescents might correlate the care they receive with the care that is put into the clinic. So as we saw in the whiteboard video at the beginning of this webinar, a dying plant in the lobby may make an adolescent feel like they may not be well taken care of either. And things as small as a crooked poster can make a teen feel less confident in the health center and staff. So think about other ways in which you can make your environment welcoming to teens. So privacy screens and sound machines can help create a sense of privacy. You could have docking stations for cell phones in the waiting area and exam rooms, free Wi-Fi or gadgets in the waiting area. Displaying safe space stickers near the front desk and in the exam rooms to signal that your health center is a welcoming space for LGBTQ plus youth. And then gender-neutral signage and gender-neutral restrooms are changes that provide a powerful message that your space is affirming of all identities. A quick word of caution about this. Often adults think that they know what will make a space feel more youth-friendly, but we really recommend that you check with your patient population to see what changes they might prefer. So if you're making plans to update your space, ask your adolescent patients what kind of magazines they'd like to see, what kind of artwork they'd like, or what paint colors they might think are cool. In a few minutes, we're going to chat a little bit more about some strategies to get that kind of feedback from your patient. Okay, let's chat. Now we want to hear from you again. Using the chat feature, share some things that your health center does well to make the environment welcoming to adolescents. Teen-friendly magazines, local photography, yep. That's great. I love the idea of local photography on the wall. Any others? Music in the waiting room, that's another great idea. I think that kind of can help set the mood and also be a way to add some privacy, right? Yep, safe space for LGBTQ. Great, thanks so much. All right, we're going to take another poll. So using the 0 to 2 scoring system, please answer the following question. Our health center provides training on cultural humility at least every 2 years, addressing topics such as sexual orientation, gender identity, and cultural norms specific to the patient population. So go ahead and take a moment and fill out your poll results. Okay, we'll give everyone another second before the results come up. All right, great. It looks like people have done some really significant work in this area. So a lot of you have already kind of fully implemented this sort of training, some of you partially, and about a third of you have not yet implemented. So we're going to talk about some strategies to kind of help meet people wherever you are. So when we talk about meeting the needs of our patients through culturally sensitive, when we talk about the needs of our patients through being culturally sensitive, it's really helpful for us to define what we mean by culture. So according to the National Center for Cultural Competence, culture is the learned and shared knowledge that specific groups use to generate their behavior and interpret their experience of the world. So it includes things like attitudes, language, tone of voice, body language, concept of time, eye contact, religion, sexual orientation, family roles, education, income, tradition, and age. So it involves a lot, right? This definition of culture. So when we recognize how our patients might have specific needs based on their cultural identities, we can work toward being culturally responsive. And making sure we are culturally responsive is especially important when we work with teens because, as we know, teens may already be treated as less than by adults. So we can look at the age group of adolescents as one more part of culture to consider when we're trying to be culturally responsive. So for those of you who don't currently offer regular trainings, and for those of you who will be re-offering trainings in the future, let's take a moment to discuss some resources that are available to you. So AHI offers 2 Spark trainings on cultural responsiveness. The first training, Culturally Responsive Care, identifies and discusses key concepts about providing culturally responsive care to young people and helps health center providers and staff reflect on various cultural norms that are unique to adolescents. And the second training, Nonverbal Communication Bias, explores how nonverbal communication can set the tone for youth-adult interaction, both in the messages we convey and how we interpret messages from youth. So what is a Spark? I just mentioned that we have these Spark trainings available for you. So we know that health practices across the country have limited time for staff and provider training. And so to meet the needs of busy health centers looking to improve their adolescent-centered practices, AHI offers these mini trainings called Sparks. So Sparks are pre-packaged, they are free to use, and they include a PowerPoint presentation, a facilitator script, and follow-up materials. They're really meant to be turnkey to make it as easy as possible to integrate into staff meetings. And so they're designed for providers or staff to deliver in about 15 to 30 minutes at staff meetings or other professional development opportunities. And they can be facilitated by providers or staff in any role. So you could get a medical assistant or a front desk staff or sort of anyone who's involved to deliver a Spark. And they're designed to spark discussion and reflection among a multidisciplinary team. So we've developed Sparks on a variety of topics, not just cultural competence, and you can browse our full library and download them all directly from our website. So in addition to Spark trainings, there are many great resources out there to help you develop or provide training in your health center on culturally responsive care. So we've linked a few of them here for you. So there are learning modules from the National LGBT Health Center or the Fenway Institute. AHI has a video that was developed by our Teen Advisory Council on the voices of transgender youth in healthcare. The USDHHS Office of Minority Health and Think Cultural Health have great resources on their website. Advocates for Youth also provides resources for working with youth of color. And then there are some strategies that you can link to here for diversifying your healthcare workforce. So remembering that racial and ethnic minorities are often poorly represented among physicians and other healthcare professionals. And so having a diverse staff can increase an adolescent's comfort in the healthcare setting. And that's not unique to adolescents necessarily. But so this last resource offers some strategies to consider in diversifying your team. But in general, it's just important to think about which trainings and resources may be most appropriate for your patient population. All right, let's chat. So using your chat feature, tell us, what are some things that your health center does well to promote culturally responsive care? All right, so we want to hear from you. Give us some ideas. Posters in other languages, yep. Handouts in Spanish, yeah. Meeting people where they are and sort of identifying the different languages that are spoken in your health center is very important. Not just, for, to help people feel comfortable, but also related to health literacy, making sure people are getting the information they need. Any other thoughts or ideas, things that you all are doing well or have been thinking about trying to do? Yep, some information specific to your LGBTQ population, bilingual staff, excellent, having culturally diverse staff, great. Well, hopefully you'll kind of take some of these ideas and some of the resources we've shared as well, and you can kind of think through some additional strategies. Time for one final poll. Again, using the same scoring system that we've been using, answer the following question. Our health center uses a method to routinely gather feedback from adolescent patients and uses this feedback to improve clinical access, quality, clinic physical appearance, and services. So take a minute and answer that. All right, so we are waiting for the results to pop up. Again, a good mix. This one looks like maybe a little bit less fully implemented, though certainly some people have, and a little bit more on the not yet implemented or partially implemented side. This is a tricky one, so we're going to talk a little bit more about doing this. So for those of you who do regularly collect adolescent patient satisfaction surveys, you're definitely ahead of the curve. Health centers can improve their adolescent health services by listening to the values and opinions of the young people they serve. Survey responses offer insight into how teens experience your health center. Teen patients may mention concerns that are easy to fix, but something that adult staff would not otherwise consider or think of. The needs and concerns of your adolescent patients may differ from those of the adult patients, so it's important to routinely collect feedback from young people to ensure that your health center is providing patient-centered care to adolescents. And if you don't already have a standardized adolescent patient survey, or maybe you want to make some changes to your existing tool, please reach out to us. We're happy to think that through with you and share some options. And if you don't already have a youth advisory council at your health center, you may want to consider starting one. If that feels daunting, please know that we're also here to help you with that. Our website has a guide for developing and sustaining a thriving youth council, and we're available to provide some additional training and assistance for how to get one off the ground. Let's talk about some other tools. AHI has developed a youth-led assessment process for gathering adolescent feedback on their experience at a health center setting. And this assessment encompasses three components. One, a video, which you can see a screenshot of here, created by our Teen Advisory Council, titled What Matters to Youth? Perspectives on Health Care Experiences. Second, an assessment tool for youth to fill out during a visit at their health center. And third, a facilitator's guide that goes with the tool and the video to help engage young people in evaluating the youth friendliness of the health centers and providing meaningful, youth-driven feedback to providers and staff. The guide takes you through the necessary steps for identifying a group of youth to serve as your youth evaluation team, discussing the importance of youth friendliness, actually evaluating the health center, and then debriefing the experience and sharing feedback with the health center team. AHI is actually currently piloting this youth-led assessment process with health centers across several states. So if you'd be interested in piloting with us, please reach out. We'd love to talk to you about how to do that. Okay, let's hear from you again. Using the chat feature, share some of the things that your health center does well to gather feedback from adolescent patients. Quarterly surveys, comment cards are a great idea. Oh, you just started a yak this year. That's exciting. Great. You provide a survey. Yeah. Great. Sounds like you guys have got some of these things in motions or are kind of at different phases in that. All right, well, thank you all for sharing some of your strategies as well as part of this discussion. So as we wrap up today, we wanted to reiterate that there are 12 key areas of adolescent-centered care, and we touched briefly on 3 of them today: adolescent-centered environments, cultural responsiveness, and adolescent engagement. But we want you to know that AHI has other resources available and that our team is able to work with your health center on improving care for adolescent patients. So in addition to the SPARK trainings, we have, we also have starter guides to help you improve immunization rates, implement confidential risk screening workflows, develop collaborations between primary care and school-based health centers, and many other topics. We also have a library of great videos that our Teen Advisory Council has created for providers, teens, and parents. Some of those topics include teen self-advocacy, voices of transgender adolescents in healthcare, and a video for parents on empowering teens called Take the First Step Out of the Exam Room. These videos are really great for staff training or team meetings. You can have them playing in your waiting room, or you could even embed them into your own website. Additionally, we have health center posters, resources, and a variety of ways that we can work directly with your health center should you need some additional support. So all of those starter guides and sparks and videos and health center materials I mentioned, they're free resources that AHI has developed, and so we'll hope you'll go onto the website and check them out. And we are certainly not the only ones who have some good stuff out there for you. So we encourage you to check out some of the great resources and services from the School-Based Health Alliance, from the Society for Adolescent Health and Medicine, ARSHIP, the CDC, and the Healthy Teen Network. So we want to say thanks so much for your participation today and hanging in there with us as we had a few technical glitches. But we hope that you'll keep in touch with us. You can connect with us on social media. That's where we announce a lot of our new resources and materials that are out there. But feel free to send us an email or connect through the website. And we hope that you will save the date for the 5th annual conference on adolescent health, which is taking place on April 23rd and 24th. This is an international event that brings together an interdisciplinary audience of health professionals. And if you haven't already submitted your abstract for a breakout session or an oral presentation or a poster, today is technically the deadline, but just between us, we will let participants from this webinar submit until Tuesday, October 10th. And you can find the submission forms on the conference page of our website. So thanks again, and now we'll be happy to answer any questions. We're going to hand it back over to the School-Based Health Alliance team.
Thank you very much to our presenters for their information that they shared today. So right now is the time where we are going to start accepting questions for our presenters. While we give everyone an opportunity to answer their questions, we do have a few announcements. And please make sure that you enter your questions in the Q&A inbox. So while you enter your questions, let me tell you a bit more about our membership. The School-Based Health Alliance works to improve the health status of children and youth by advancing and advocating for school-based health care. Our members extend and support our work. Trainings like this webinar would not be possible without the support of our members. In addition, our members receive exclusive access to valuable program tools, timely publications, and networking opportunities. So please take a moment after the presentation to visit our website using the link on your screen for more information and to join. So this is a little bit more information about our ECHO project. So please take a look at the slide, and if you have more questions, feel free to contact Selena Moore. Her information is listed on the slide. We would also like to announce back to school reminders. So let's talk data. You can now complete your national school-based healthcare census and report national school-based health clinic performance measures, centers performance measures through our census portal. Please take time to get more information on our website and enter your data today. And we are also accepting abstract submissions for our 2018 National School-Based Healthcare Convention. Our 2018 convention will take place on June 24th through the 27th in Indianapolis, Indiana. So please save the date, and we look forward to seeing you there. So now we are going to go back to our questions. Now we'd like to ask our presenters a few questions. So we've had two people who asked if the presentation will be made available. This presentation will be available on our website within 3 to 5 business days after the webinar. So you guys will have access to all of the slides that Lauren and Ellen presented. We have another question. So we have 2 school-based health center sites run by an FQHC at our community high school and intermediate school. We are about to expand to another local high school and will be opening an adolescent clinic purely geared towards reproductive and confidential behavioral health. We are located in a rural community in Hawaii. I'm very interested in learning how we could join the pilot you mentioned earlier. How do we go about pursuing this?
Great. So the best thing to do would be to just send us an email, which is on this. Our email address is on the slides, but it's also adolescenthealth@umich.edu. And we can talk through what the pilot process looks like. But it sounds like you guys are expanding into a great and highly needed area. And so be happy to talk to you about that.
Great. So I believe that was the last question. If you guys have more questions, feel free to send them in the Q&A box. If we are unable to get to all of the questions today, we will be sending over the information to Ellen and Lauren, and they will definitely respond back to you as soon as possible. All right. So I want to thank you again for attending our webinar. Thanks again for being so patient with us while we dealt with our technical difficulties. And our sincerest thank you to our presenters. So thank you. Oh, wait, I think we have, yes. Thank you very much.
Thank you. Thanks, everyone.